So kama mimi vile nasikia niko na nini heartbreak hapa, mtaangalia wapi?
Wewe inaonekana tutakata tuone. Looking at your heart. But
I did one maybe a week ago.
You did one a week ago. What did they say you have?
Niko na roho safi sana.
Hatuhitaji kifagio.
Did you listen to the Hot Breakfast this morning? Here's what you missed.
Traditionally, it's been run only in Nairobi. This year, it'll be run in 11 towns across the country, including
Kakamega, Kisumu, Meru, Nakuru, Machakos, Nyeri, Mombasa, Kericho, Nairobi, Bomet, and Eldoret, and it'll be run simultaneously. So get your Mata Heart Run t-shirt for 1,000 bob, or the Polo t-shirt for 2,000 shillings, a cap for 500 bob, or a wristband at 300 shillings. You can buy all of them. And your donation should be channeled to 526-300. That's the payable number. Account, write your name. Yes, sir.
526-300. And in the studios today, we're going to be talking to a couple of guests. Emily Wamboi Wambogo is a cardiac coordinator at Mata Hospital. And Nancy Kuthi Margaret is a recipient of this wonderful gesture. She used to suffer from congenital rheumatic heart disease, and now at 26 years old, she is about to run in the next Mata Heart Run.
Yes, so she's a beneficiary of what Mata Hospital does.
It's all about.
And the funds from this has changed the lives of many people. Welcome to the studio.
Welcome to Hot 96.
Thank you.
Karibuni sana.
Asante.
So Emily, what exactly do you do at Mata?
I coordinate the care of patients who have cardiac disease and they require either to go to theater for open heart surgery or to go to cath lab for further diagnosis through cardiac catheterization, or they require cardiac intervention where small holes can be closed without opening the heart.
How does one know they've got a hole in their heart?
They come for what we call full cardiac evaluation, and they are seen by a special doctor, that is a cardiologist, and there are two specialists. One is for adults, that is a physician doctor, and we also have one that is pediatric cardiologist. At the evaluation, the doctor does a full examination. We will do an electrocardiogram, which is normally abbreviated as ECG or EKG, and also we have an echocardiogram, which is like a scan of the heart. And through the scan, the doctor is able to visualize the anatomy of the heart, and they are able to determine the anomalies that are there. It could be a hole in the heart, it could be a vessel that is stenosed, it could be an enlarged heart that is not pumping very well. And I need to mention that the heart is like a pump. So if there is any anomaly in the way it is pumping blood out of the heart, or how it is receiving blood from the other parts of the body, that means there is an anomaly. If there is also an anomaly or a hole in between the walls of the heart, it could be in the upper chambers that we call the auricles, or it could be all the atriums, that's what we call them in medicine, and also it could be the ventricles. There can be a hole. Then one of the vessels that leads out of the blood out of the heart, we can talk of the pulmonary artery. It can be stenosed. That means it is not functioning well. It's not taking the blood out of the heart to the lungs. Or it could be the vessel that takes the blood away from the heart to the other parts of the body, the aorta. It could also have a problem. It could be stenosed. The valves that also connect the upper and the lower chambers of the heart could also be deformed, meaning either they are not opening and closing properly, or there is something we call regurg. The blood is not going in the direction it's supposed to go. So at echo, the doctor is able to determine exactly what the problem is, and that is when we get the diagnosis.
And you can do all of that at Mata?
Yes, once the diagnosis is made, you have those that are congenital, born with, especially the holes, and you have the acquired, especially the valves are affected by rheumatic fever. like what Nancy had. So once that is determined, at Mater, we are able to do open heart surgery to close holes, repair valves, replace valves. We are also able to do procedures in cath lab to dilate stenosed valves or vessels. Together with that, for adult patients, those who have coronary artery disease, the doctor is able to do coronary angiogram, a procedure that is done to check the patency or how the vessels that supply blood to the heart are opened. So in case there are any constrictions or blockages, at Mater we are able to do that in cath lab by putting stents, what we call coronary angioplasty, or the patient can go to theater for what we call coronary artery bypass graft. We call it cabbage in the medical jargon.
Cabbage.
Yes, and it is meant
loves
to.
cabbages also.
I love cabbage.
So it is that procedure is to revascularize the heart to make sure that the heart gets enough blood.
Okay.
All these procedures can be done in Mater.
Nancy, tell us your story.
Okay, first I was diagnosed at Kenyatta National Hospital, and then I was referred to Mater Hospital, where I was first seen in 2010. And then at that time, I was to undergo a balloon valvuloplasty procedure, and then my family could not afford the amount which was needed. So the Mater Heart Run Foundation came in, and I was able to undergo through the procedure under the Mater Heart Run Foundation. And after that, there are a number of things which changed after the procedure. But then I could not be able to do some strenuous activities like maybe running. Maybe I could not perform day-to-day activities. But after the procedure, I was able to do all those things, because by then I used to get tired, but right now I don't get tired. Yes.
How old were you when you were diagnosed?
I was diagnosed at 12 years, and then I went to Mater at 14 years.
And what was it? Rheumatic? Is that what it was?
Rheumatic heart disease. Yes,
Okay.
which affected my mitral valve. Yes, and after the procedure, it was opened because it had a small diameter that the blood could not get into the heart. Properly.
Emily, do you see these numbers rising? Have you seen in your time at Mater the numbers of young Kenyans under the age of 18 rising with heart disease?
Yes, we are getting the numbers rising, but as the numbers are rising, also we have other hospitals coming up, and the condition is diagnosed early, and these patients are being treated. But also Mater does outreach program where we go to these counties where we are talking about having the runs, and we screen children for rheumatic fever and rheumatic heart disease. And we have regions in Kenya where this disease is prevalent, so there are many numbers. Some of them have lived with it for long. By the time they are coming, the heart is damaged, and maybe they need a valve to be replaced or a valve to be repaired. And I would want to say to our Kenyan population, it's not every sore throat that is viral. For children below the age of 18, they need to be taken to a doctor who is able to determine whether it's viral or it's bacterial, and is treated appropriately. And the treatment is very cheap because they use penicillin to treat the rheumatic fever, and it goes a long way in preventing rheumatic heart disease, like what Margaret had. She talked of the mitral valve. The mitral valve, we can say it is like the valve that connects the left atrium to the left ventricle. The left atrium receives blood from the lungs, meaning that is the oxygenated blood that is supposed to get into the left ventricle, and then it gets into the aorta and to the rest of the body. If this movement is interfered with, it means that the person will not get enough oxygenated blood. And therefore, Margaret said she would not do most of the activities. She used to get tired. She could not run like the other children. Her time in school was difficult. You know, children want to play, but when they are sick, they will not play. So the disease is still there. We need to hold hands together for treatment. That is by sponsoring children who already have the disease, and we have many in our registry who require either to have open heart surgery for repair or replacement.
What are the symptoms to be on the lookout for? I'm sure a kid getting tired of being unable to be jovial and up and down is one of them. But you see, some of those things can also be misdiagnosed as being lazy. What can a parent, what should a parent not ignore in terms of symptoms?
What a parent should not ignore is any sick child. Any sick child should be listened to, and it is okay.
Yeah.
And one of the things that should not be ignored is fever. Initially, if you're talking about rheumatic fever, there should be, the temperature should not rise. They should not be hot. The hotness of the body, let me talk like a mother. If the child is having fever, is not being able to eat, is tired all the time, or doesn't want to go to school, they should be taken to the hospital. And let's not think in terms of Nairobi where you're talking about matter. Let's go to the village. Every village has a dispensary. There is a health center. In that health center, the healthcare workers that are there, they know when a child is sick, and they have the basic we can say instruments, like they have a thermometer or whatever it is. So if a child is taken to hospital, at your level, even here in the city, if you cannot go to the major hospitals, there are small dispensaries, health centers. Let us diagnose our children. Let us check their throat, listen to the chest, like for the physicians, because one of the signs is that there could be sore throat, the child could have fever. If it has gone further, if somebody is auscultating the chest, ile mnasemanga kusikiza kifua with a stethoscope, the doctor is able to get a mama or a sign that the heart is not well, and then we refer. We can refer through the public system, and if our health system, and I don't want to be quoted, if the health system was working properly, we would have a system whereby you come from the dispensary, you are referred, then you end up in Kenyatta and you're done your surgery.
Why do people opt to go to India and other places?
Now, going to India is two-way. People opt to go to India because they can afford it sometimes. You know, there's a hospital in India, you are well managed and you can afford it. There is another way of people going to India, like still in our country, there are a few heart operations that we cannot do. Not that because we don't have the expertise in terms of management after surgery, our facilities. Even in Kenyatta, there are some conditions they would not operate because maybe they are not able to take care of the child after that. And those are the patients that are referred, and they are referred in a transparent manner because even the National Hospital Insurance Fund facilitates.
Nancy, are you fully recovered?
I still go for checkups.
You do?
Yes.
So are you fully recovered? I'm like 98%.
No, it is a condition which is manageable.
Right.
So you have to follow up so that there is no recurrence of the disease.
So how often do you go for checkup?
Once in a year.
Once in a year. How do you feel? I mean, do you feel you've recovered? Can you do the things that you wanted to do before? Can you run? Can you?
Yes, I can run, but not like any other person, because at first my heart, I cannot say that it is 100% like any other person who has never contracted the rheumatism. But I am better than before.
Yeah.
Yes.
You must have been scared during COVID.
Yes, of course, I must take care of myself. Yes.
In every county, during the Matter Heart Run and this period of selling t-shirts to the children, we shall be having those beneficiaries going to give testimonies and running those who can be able to run. And even even here, when we'll be having the Matter Heart Run at the KICC, I'm going to have more than 10 beneficiaries. I have so many beneficiaries who have benefited from the program, because if you check from the statistics we gave you, we have about 4,854 children who have passed through the cardiac program.
Since it started.
Since it started.
How many?
4,000.
Wow.
Around 4,854. And then we have been able to reach more than 130,000 children through our outreach programs. And when we go for outreach program, the children we find to have cardiac ailments, we bring them to Mater Hospital, and they are immediately enrolled into the cardiac program, and they are sponsored.
Do you have a program where now you're looking for, like doctors locally who you can sponsor to go and, further the education in this field and then come back and help here? Because I feel like that would make more sense then. Or how does it work in that field?
Well, it works both ways. And Mater has sponsored some doctors to go abroad, and their nurses, especially to India. And I am one of them.
Okay.
I said I am a nurse, a cardiac nurse. I was taken to India by Mater Hospital in 2006, and from then they have trained other nurses. They have trained perfusionists. A perfusionist is somebody who takes care of the heart. When the heart is being operated on, the function of the heart and the lung has to be taken care of. They search that specialist Mater has trained. Then they have also sponsored some cardiologists to go out there and train and come back.
So kama mimi vile nasikia niko na heartbreak hapa, mtaangalia wapi?
Wewe inaonekana tutakata tuone. Anyway, on a lighter note, looking at your heart, but
I did one maybe a week ago.
You did one a week ago. What did they say you have?
Niko na roho safi sana.
Hatuhitaji kifagio.
Uko na roho nzuri sana Nika. I was going to ask, I'm sure everyone is encouraged to, maybe do what's it called, medical checkup, the full one.
Yeah.
Maybe you can talk to adults, because a lot of people just ignore, if you have insurance or even if you don't, the one thing you should make sure you do in terms of your health or your heart.
Now, when I have already talked about the rheumatic heart disease and the child below 18 years. For the adult, we need to have our medical examinations done. And not only when the insurance is asking you for a medical examination so that they can undertake your cover, but once a year or every time you're feeling unwell. Let us stop going to buy medication over the counter. Let's go to the hospital. And in our hospital, we do have a program for the well people, like Nick. What you do, you say you want to come for wellness clinic. You hear how I'm calling it?
Yeah.
Wellness. So when you come for wellness clinic, what they do, they will check everything about you. They will do you the vital, they'll take the vital signs, they will do your ECG, they will do a chest x-ray, they can do a full hemogram, which will tell you the levels of your blood and all that. They will do lipid profile, that is to check the heart, how the heart is functioning and all that, and cholesterol. Remember, you're not sick, you're just checking so that we see the values that you're having against the normal values. And from there, if you're having an issue, you'll be referred appropriately. If you're hypertensive, you'll be referred to a physician. If your heart has an issue, to the cardiologist. If you have issues of sugar, to the diabetologist. But I wouldn't want you to reach there. When we see the numbers are the comparison, there's something to worry about, you are advised on something we call lifestyle change.
And see, some advice to people your age. There's some kids out there who have lost any hope in life because they think they'll know, they have heart problems and they'll never be healed. They'll never get well.
I would tell them to never ignore sore throats. And
Sore throats, huh?
Yes, sore throats. sore throats and fever, because ignored sore throats can lead to rheumatism, which can affect your heart. For example, me, I used to get on and off sore throats when I was young, but I used to be given maybe sugar, and then it would go away. Every other time when I get fever, I could be given painkillers, and then it would go away. Sometimes I could get swelling of the legs, but I didn't know what it was because I was young, so I thought maybe it is because I've been sitting for long, that's why my legs are swelling. Other times when we go for cross country, I used to get tired and I couldn't know what was happening with me. I used to think maybe am I lazy, but after some times one of the teachers noticed that maybe there was something wrong with my health, and then the teacher notified my parents. That's when I started following up what was wrong with my health.
Sorry.
Yes.
Continue.
So I think the parents should be very keen with their children. If they notice something, then they should not ignore. They should consult maybe a doctor, or they should take the kid to the hospital.
Yeah.
Yes.
After that experience, have you ever thought of joining the medical field? Like, I feel like if I went through one of those, I'd say I'd also want to save other children,
Yes. At first, I wanted to be a cardiologist when I was maybe in high school. But after that,
ulifungua vitabu ukasema
I wanted to be a cardiologist, but maybe I wasn't good at maths. That is what made me not to join the medical field.
Okay, so what are you doing now?
I am done with my university degree. I did international relations and diplomacy.
Ah, nice.
Yes.
Nice.
That goes to the heart of the matter.
Yes.